Do you frequently feel like your muscles are weak when climbing stairs or lifting things? Like your arms or legs just don't want to work? Or maybe you've noticed a strange rash on your eyelids or knuckles that doesn't go away. These could be signs your body is fighting itself in a quiet, hidden way. That's what happens in dermatomyositis, a rare disease where your immune system, which normally protects you from colds and infections, mistakenly attacks your own muscles and skin. It's like a security guard attacking the very person they're supposed to protect. And while it's not common, recognizing the signs early can make a big difference in how well someone manages it. So why does your immune system turn against you? That's the big mystery in dermatomyositis, but scientists believe it's a mix of your body's wiring and outside triggers. Think of it like a car alarm that goes off during a thunderstorm. Something sets it off even though there's no thief. In this case, your genes might make you more likely to develop the condition, like having a sensitive alarm system. And things like viral infections, sun exposure, or even certain medicines could press the trigger. It's not caused by germs you catch from others, so no, you can't get it from hugging someone who has it. But if your family has a history of autoimmune diseases, like lupus or rheumatoid arthritis, you might be at higher risk. Imagine trying to stand up from a chair and your thighs feel like jelly. Or putting on a shirt becomes hard because your shoulders are so weak. That's muscle weakness in dermatomyositis. It usually affects the neck, shoulders, hips, and back. But here's the part that makes it different from other muscle diseases: the rash. You might see a purplish or red rash around your eyelids, called a heliotrope rash, or on your knuckles, elbows, or knees, sometimes with a rough, scaly texture. Doctors call these Gottron's papules. Some people also get pain in their joints or trouble swallowing, like food gets stuck in the throat. Oh, and the rash can get worse in the sun. So if a walk outside leaves your skin angrier, that's a clue for doctors. First, they will ask about your symptoms and do a physical check, like seeing if you can rise from a chair without using your arms. Then, they might order blood tests to check for high levels of muscle enzymes, like CK, which leak out when muscles are damaged. They might take a small sample of muscle tissue, a biopsy, to look for inflammation under a microscope. An EMG, electromyography, can check if your muscles are sending electrical signals normally. And imaging like an MRI can show swelling in your muscles. Once confirmed, treatment usually includes medicines like corticosteroids, for example, prednisone to calm the immune system. Think of them as off switches for the overactive immune response. Other drugs like methotrexate or IVIG may be added. Physical therapy helps keep muscles strong, and sunscreen is a must to protect the rash from the sun. Right now, we can't fully prevent dermatomyositis because we don't have control over genetics or all immune triggers. But you can reduce risks and complications. For example, wearing strong sunscreen SPF 50+ every day, even when it's cloudy, can help protect your skin. Avoiding long sun exposure during peak hours, 10 a.m. to 4 p.m., is smart. Staying active with gentle exercises like swimming or stretching helps. Keep muscles strong without overworking them. Eating well, avoiding smoking, and managing stress can also support your immune system. And if you notice early signs, like unexplained weakness or a weird rash, getting to a doctor early can stop more damage. It's like fixing a small leak before it floods the house. Science is moving fast. Researchers are now looking at specific proteins in the immune system, like interferons, that go into overdrive in dermatomyositis. New drugs targeting these pathways, such as JAK inhibitors, like tofacitinib, or monoclonal antibodies, like rituximab, are being tested in clinical trials. Some patients who didn't improve with old treatments are seeing progress with these new ones. There's also better use of MRI and blood biomarkers to track the disease without repeated muscle biopsies. And scientists are exploring how viruses like Coxsackie might trigger the disease, which could lead to future prevention strategies. It's not a cure yet, but the road ahead looks more hopeful than ever.